I'm Dr. Daniel Paull. I'm an orthopedic surgeon. My company's called Easy Orthopedics. It's about a year old, and it's a different sort of business model where I do house calls and go to people's houses. I don't bill insurance or anything like that, and that allows me to spend time with my patients, usually 45 minutes to an hour, and really to practice relationship-based care, which is what I like, and I think what patients like, which they find is missing lately in the kind of transactional nature that we have right now in the healthcare industry. And the only way I'm able to do this is by not billing insurance. I don't have all the overhead associated with it. And you know, a lot of people don't have good insurance. Their deductibles sky high, or you know, they don't have anything at all. A lot of small business owners. So it's a really nice fit for them. Well, during the job search process for me, I found that a lot of these jobs, while some of them may have paid okay, they weren't in the locations that I wanted. And you know, I worked hard for a long time, and I want to spend time with my family and my kid, and you know, that's just it just didn't vibe with what I wanted to do, and it didn't present the model didn't allow for me to practice how I really wanted to practice. I think what was helpful to me was connecting with other entrepreneurs and small business owners and people who had kind of done what I'd done, but in maybe a slightly different model and a different location, and kind of, you know, talking to them, seeing that they were really happy, they liked doing what they were doing, and you know, give you the motivation to kind of take the risk, you know, which a lot of doctors are risk averse, so you know, to take that risk and start. So for me, connecting with other small business owners and entrepreneurs was incredibly helpful. I think you need to find a job that works for you. You need to decide what's important for you. You know, is your family important? Is location important? And don't just kind of jump on the first job. You know, interview there, see if the people there are happy. And you know, you can ask them, are you happy here? And despite what their answer is, you can usually get a good sense off their facial reaction. And if you can't find it, don't be afraid to go into solo practice, but know that solo practice is going to look a lot different than what those large groups look like, meaning that, you know, you have to cut away a lot of the overhead in the sense, and mostly of insurance billing. If I took insurance, I would need to hire at least 5 people, and that would cause me to have to see a lot more patients, and then we'll compress the patient time down. So by not doing that, it cuts my overhead down to the floor, especially since I do house calls as well. And it makes my EMR just so simple to use, because a lot of docs don't like EMRs because it turns a doctor into a biller. So by getting rid of that aspect of it, I mean, you have a very simple EMR. So I'd say don't be afraid to take risks. Just make sure that they're calculated and know that you can do solo practice. It's just going to look different than what you picture.